So what's the most exciting innovation you've seen this week, and why?
I saw an innovation of a baby, what do you call it? The pump. The pump that delivers air to a baby.
Like a neonatally
Absolutely.
resuscitation.
Resuscitation. And basically what interested me about that is because a lot of times I'm a doctor myself, and we try to resuscitate. We put the resuscitator on, we're pumping, and we're not really sure if the air is going in or if it's going out, especially if, a baby is big or something else. But this machine actually shows you that the airway is patent and also shows you that the air is being delivered. And I think it's great. And, I think that for people that are not medically inclined, especially in situations where we're looking at task shifting and getting more people that are not medically trained to deliver some of these services in the absence of a medical personnel, this is an effective, tool that can be used to save a baby's life in the absence of medical aid.
Wow. And on that note, so why do innovations for maternal and newborn health matter so much?
For me personally, it's a big issue. If you look at Nigeria has one of the highest maternal mortality rates in the world, second to India. Same thing with neonatal. And basically, it's looking at our wealth, and our children and mothers die off. I mean, it's really sad, especially when you realize that with little interventions that these lives can be saved. And so for me, it's a personal thing in terms of trying to look at how we can support, and especially for PharmAccess Foundation, in how we can support in improving maternal and child health care so that we can reduce, at least, make a dent in the maternal mortality indices, especially in Nigeria and across the 5 other countries that we work in.
Yeah, thank you. So speaking about PharmAccess, why is your organization here today?
We're here because we're a grantee. We've been on a SLAB fund for about 2.5 years now, and it's looking at improving demand creation and also improving supply side interventions under a community-based health insurance scheme to improve the access of quality healthcare services to mothers and children.
So what have you enjoyed and learned at this development exchange?
Oh my God, I love the interaction, and I love the opportunity of exchange in innovations, and also to give an opportunity for you to also be criticized based on your innovation and see how that can be adapted to other environments. I mean, it's one thing to create an innovation for your environment and your country, but the question is, how can this be transitioned and scaled up in other countries? So for example, one of the issues that was discussed today was how the innovation in Malawi was accessible, but the reason why that happened is because healthcare is free. Now, although that innovation is great, how will that come or apply in Nigeria, where healthcare is not free, where over 70% of people live on less than $1 a day, where there are great constraints to health-seeking behavior? How do you apply these innovations? It's about cross-country, cross-continent learnings and applications to save maternal and child healthcare.
Well, thank you so much.
Thank you.